You're watching Cetome TV. Knowledge is power.
So briefly, I'll cover this very quickly. So, what can happen? Let's say you find that you have a HER2 mutation. Let's say you've been on tamoxifen for 5 years. Everything's been good. All of a sudden, your cancer comes back, and your doctor says, "Okay, we're sorry. We've tried everything. The only solution we have now is intravenous chemo or oral chemo. There's nothing else we can do for you." Then what you can do is you can get what's called a liquid test, and that's where they take the tumors from your blood, and they take the tumor DNA. So all tumor cells release their DNA into the blood, and it's fairly stable in the blood for quite a while. And so what this test does, it's called a liquid biopsy. It's called a discovery liquid biopsy. And what they do is they isolate about the tumor DNA, and they look at about 300 different genes, including HER2 and the estrogen receptor, which are the two key genes that get mutated. So if you have a mutation in your estrogen receptor, then there's a class of drugs called receptor or selective estrogen receptor modulators called SERMs and selective estrogen receptor degraders. So there's a class of these drugs. There's actually about 6 or 7 of them right now that have just been developed, and that some of them are available. One of them's available. So they're the latest thing. So if you have a mutation in your estrogen receptor, then you can try one of these drugs, and it will probably be very effective. If you have a mutation in your HER2 receptor, there's a drug called Neuratinib that is incredibly beneficial at binding onto damaged HER2 receptors and that have been mutated. And so what it does is it actually binds it, and it's a great treatment if your treatment resistance is caused by a HER2 mutation. So very important. Number one, getting initial tumor DNA sequencing as soon as you're diagnosed with expression testing, and then after your tumors come back, 5, 6 years, 10 years, whatever it may be, get a liquid-based test to see if your estrogen receptor or your HER2 is mutated, because then there are pathways and drugs that can target that. You don't have to go on chemo. Okay.
And just for anybody who's had breast cancer for some time and just heard Alex say, hurry up and get your testing. It's always better late than never.
Yes, exactly.
So it's not like, even if you've had a couple different rounds of a few different treatments right now, and even if you've gone from no metastasis to metastasis in a variety of different places in your body, there's still great, like it's actually even more critical, I would say, wouldn't you, Alex, that you get, that you find out what's actually causing it, because obviously the treatments your oncologist is giving you are not addressing these mutations.
No.
Thank you for watching Cetome TV. Subscribe below and stay informed.